This is my first screencastify in a little while, and I wanted to go over your topics of nephrotic syndrome and glomerulonephritis. Man, that's a great Scrabble word. And it's a little bit of a misnomer, actually. It should be more nephrotic versus nephritic. And I didn't set up the initial assignments that way, and I think you'll see why once we get there. Um, and this is just more to clarify your first two assignments in the renal unit. Um, and I think after going through these, I was either hoping that people were going to realize that things were a little bit confusing, or at least raise the question that, hey, we're dealing with the nephron, and specifically, we're dealing with the glomerulus, and that a couple of times that you would see things that showed up with the nephrotic syndrome and said, hey, lupus showed up here, and it showed up with a disease process that showed a whole bunch of protein in the urine. And then you would get something where under the disease process of glomerulonephritis, excuse me, I got the hiccups this morning, guys. That hey, it can also have a whole bunch of blood show up in my urine, and what gives? And why would there be a difference? So let's try to layer things out about how things could show up and what's going on. And I'm not going to go over specific processes like lupus or Alport syndrome or FSGS. I just want to leave it as nephrotic and nephritic here, because you're really, in both cases, dealing with something that's glomerulonephritis. And what the two things have in common and where it's different and why you see protein in the urine with one and then blood and protein in the urine with the other, and why you wind up differentiated a little bit. So let's do it. So what they have in common. So both nephrosis diseases and nephritis, again, they're syndromes. It's not one specific cause leading to all the symptoms. You've got multiple underlying problems that can cause very similar symptoms and signs. And depending on the insult, you can get milder disease, moderate, or severe disease. So sometimes people recover, and then they go on to lead normal, happy lives. And sometimes they don't recover, and you wind up having chronic issues, dialysis, and transplants. So both syndromes can act on the same general region, which is the nephron, and specifically the glomerulus, the very first part of the nephron, where the initial filtering occurs. So you're not dealing with the proximal convoluted tubule or the loop of Henle or the distal convoluted tubule. You're at the very beginning. So it's not a case of one of these is better and one of these is worse. It's just slightly different. And sometimes in my slides here, I call things P. I'm going to be a little juvenile at times. But since the change that you get to the glomerulus is a little bit different, what you're going to see in your urine is going to be a little bit different. So nephrotic syndrome. So again, I'm not looking at one cause of nephrotic syndrome. I'm just kind of taking a look at all comers together. Here's what you have. You see patients having high blood pressure. You get swellings. People look really puffy. Weight gain. They have protein in their urine. They have high cholesterol and low albumin in their blood. So this is now proteins in the urine, high cholesterol and low albumin we're talking about in the blood. But there's no blood in the urine. So why? So the high blood pressure, and there's a lot of reasons for this, but you can think of this kind of collectively as filter failure. You get a lot of sodium retention. So sodium, if you get a lot of sodium that's being retained, that leads to fluid retention. Water follows the sodium, so you're having extra fluid being held on to, and if you've got more fluid in your bloodstream, your blood pressure goes up. You also have low protein in your blood, and that means you're going to hold on to extra fluid. And we will pick up there in part 2.